chair a little bit. So I want it fairly close, and I want it angled. Got her set up on the bed. I'm going to have my helper behind me. So you guys have to work in groups of 3 now. We'll do this with and without the sheet. We'll do it without the sheet first. So a lot of times the therapists are going to use a sheet just practical purposes. If you're doing this transfer with someone that's got nothing on but a hospital gown, you're going to use a sheet. You're not going to want to grab underneath them when they don't have anything on underneath. It's best if you do have hospital pants, which look kind of like scrub pants, to put those on a patient before you start doing the sliding board transfer, just so that it's less forgiving on their skin, sliding across that board. If you're going to do that, you've got to have some pants on. So that's why we a lot of times use a draw sheet. Okay, so the first thing we have to do is get that placed. You guys have to hear this. Like, if the sliding board transfer starts going bad, it's not going to get better by continuing. You got to just bail, abort mission, go back, and start over. Because if you keep pursuing a bad sliding board transfer, you're going to have a patient on the floor. Okay, so get the sliding board placed in a really good position, and then once you start bringing the person across on the sliding board, have that person really keep an eye on how that sliding board looks, and if it's starting to slip or slide or tilt, start over. It only gets worse. All right, you want the surfaces as level as possible. So the people are on there. Bridge. All right, we got to get this placed first of all, and I like to get the sliding board placed so that it is kind of more on the thigh than underneath the rump. Kind of thinking like your ischial tooth is like a little bit of a pivot point. Okay, so you can imagine if you've got your butt right here, your ischial tooth, as you start weighting that, this is where the weight is, and this is a pivot point, your board will start to tip like that. And you don't want to be sliding across on a board that's tilted forward like that. They're going to end up on the floor. You want the board to stay level, or maybe even a little bit tilted that way. So I want the pelvis to be kind of toward the rear of the sliding board. So I err towards having it a little bit more under the thigh. If you are transferring with somebody that's an amputee, really exaggerate having it under the thigh, because they don't have that counterweight of their feet on the floor. And they will really, once they start progressing over, they really tend to kind of migrate to the front of the board. And since they have no counter, they just slide it to the floor. Okay, so I'm going to go towards having this more underneath her thigh, in front of her pelvis. So I'm going to lean her this direction. I want you to kind of guide the shoulders. I'm going to lean you over, and we're going to put this board underneath your hip. Okay. So, hip up, and yep, right there. Yep, exactly. At this point, I can kind of adjust my chair a little bit closer if I want it closer. And I think we're probably going to do this in about 2 scoots. So it's just like that lateral scoot that you did at the edge of the mat. We're just going to lateral scoot to here, and then to here. And you can help. So put your hand here. Keep your hand flat. I don't want you to throw your hand underneath here. Okay, that's where it's going to push. And push here. All right? See where you're going? You're just going to land like right there. Okay. Okay, you got a good look at it, because now you're going to have to put your shoulder over here. Okay. Right. Kind of my balance. No, we're sliding. I like that. Back a little bit more. Back a little bit more. There we go. Okay. So the first one is really just to get on the board. Get it started. Okay. Here we go. No, you're not nothing. You're nothing. That's okay, my right position. On the count of 3. 1, 2, 3, up. Okay, now if she can help, I can say, okay, you can hang on here, but I don't want her to lean too much that way. And make sure her feet are underneath her. Your hand here. Okay. This next one, I think we can get her all the way to here. So you might want to step here at this point. Okay. All right. Move forward. Notice my stance is kind of across the area we're going, so I don't lose my balance once we get there. 1, 2, 3. And just sit here. How much were you helping? Right? That's the sliding board transfer.